Burke's Peerage has been tracking British aristocratic bloodlines since 1826. Every edition carries the same implicit promise. These are the verified facts of family lineage, the official record of who existed and when they died. In its 1963 edition, under the Bowes-Lyon family entry, two names appear with death dates attached. Nerissa Bowes-Lyon, died 1940. Katherine Bowes-Lyon, died 1961. Both entries were lies. Both women were alive when that edition went to print. Both were confined inside Royal Earlswood Hospital in Redhill, Surrey. And the person who submitted those false death dates to the publisher, the person who wrote down specific false years of death for two living women, was their own mother. Nerissa Jane Irene Bowes-Lyon, Katherine Juliet Bowes-Lyon. Their father, John Herbert Bowes-Lyon, was the brother of Lady Elizabeth Bowes-Lyon, the woman who became Queen Consort in 1936, who outlived her husband by 5 decades, and who the British public came to know as the Queen Mother, the warm, resilient, accessible grandmother of the nation. Between the family she presented to the world and the family that existed inside a Surrey institution, there was a gap the width of 2 human lives. John Herbert Bowes-Lyon, Jock to the family, married Fenella Hepburn Stewart Forbes Trefusis. They settled into the fabric of upper-class Edwardian life in which both had been raised, a world where family name and social station were managed as carefully as any estate. Nerissa, their third daughter, was born on the 18th of February 1919. Katherine, their fifth, arrived on July 4th, 1926. Both children had severe learning disabilities. In the clinical language of the era, they were classified as imbeciles, a formal diagnostic category that covered a wide range of presentations, but in their case meant something specific. Neither Nerissa nor Katherine ever learned to speak. Their mental ages were recorded as approximately 3 years. They grew physically into young women, while the world's assessment of their inner experience remained fixed at the most minimal possible estimation. Whether they formed attachments, recognized faces, tracked seasons, felt the difference between being visited and being left, those questions weren't considered clinically interesting in the 1920s or 1930s. The medical culture of their childhood had limited patience for the interior lives of people classified at their level. What is documented is that they existed within the family household into adolescence. Jock was their father, and while he lived, Fenella had a partner in managing the particular complexity of raising 2 severely disabled daughters within a class that regarded disability as private, embarrassing, and, ideally, invisible. In 1930, Jock died of pneumonia at 44. Nerissa was 11. Katherine was 3.5. His death compressed the care arrangement into a single person. Fenella was left as the sole caregiver, embedded in an aristocratic family network, managing daughters whose disabilities place them outside every social framework that network recognized as viable or presentable. The Bowes-Lyon family around her, led by its most prominent member, now on an ascending trajectory toward queenship, was constructing a public identity built around warmth, stability, and the projection of impeccable domestic life. Nerissa and Katherine existed in uncomfortable proximity to that image, not by being shameful in any objective sense, but by failing to fit the template the era required. For 11 years after Jock's death, Fenella kept them. Whatever the wider Bowes-Lyon family thought about the arrangement, no private correspondence on the subject has surfaced. What surfaced instead was a date, June 1941. Royal Earlswood Hospital stood on 88 acres in Redhill, Surrey, approximately 20 miles south of London. Its origins reached back to the mid-19th century, An 88-acre site was acquired at Earlswood in 1850 and opened as the Asylum for Idiots, a charity foundation operating on the then progressive premise that people with severe learning disabilities deserved specialist residential care rather than workhouse confinement. By 1866, John Langdon Down, the physician whose name was later given to the syndrome he described, worked there. The institution was renamed and restructured multiple times across subsequent decades, absorbed into the National Health Service when the NHS was created in 1948, and remained in operation until it closed on 31st March 1997. That closure occurring amid what official documentation records as allegations of irregular care and abuse. By the standards of mid-20th century British institutional care, Royal Earlswood was neither the worst of its kind nor anything resembling comfortable. Large congregate wards, regimented schedules set by institutional necessity rather than individual need, meals at fixed hours, routines repeated with the consistency of a machine rather than a home. Staff were professionals of a sort, trained in the management of people classified as severely disabled, operating within a system that made no philosophical distinction between care and containment. The idea that residents had preferences worth accommodating, personalities worth knowing, histories worth preserving. These weren't concepts the institutional architecture of the 1940s was built to honor. Most residents had no sustained contact with the world outside the 88-acre site. Their families had placed them there precisely because the family home was the world outside they couldn't navigate. Visitors arrived irregularly at best. Letters, if sent, went unanswered by people who couldn't read them. The institution managed the body. Nobody was formally responsible for managing the person. Britain's deinstitutionalization movement. The political argument that disabled people had a right to live in communities rather than within closed residential facilities didn't gather meaningful legislative force until the 1970s and 1980s. Through the first 3 decades of the sisters' confinement, the consensus among policymakers, clinicians, and the general public was that Royal Earlswood and places like it were appropriate, even humane solutions to the problem that severely disabled people were understood to represent. The patients weren't there against the current of public opinion. They were there with it. Royal Earlswood's patient records, admission registers, family circumstance documents, detailed assessments of residents' abilities and disabilities at the time of arrival, are now held at the Surrey History Centre. Nerissa and Katherine are in those records. They existed in the institutional archive, even as the family's official record insisted they were gone. On a single day in June 1941, 5 cousins were admitted to Royal Earlswood. Nerissa, 22 years old, Katherine, 14 going on 15, and 3 of their maternal cousins, Idonia Fane, Etheldreda Fane, and Rosemary Fane, related through Fenella's family line, specifically through the Trefusis connections on her side, not through the Bowes-Lyon or Strathmore aristocratic lineage at all. 5 people, 1 admission day. The historian Gareth Russell, addressing this directly, has argued that the story is fundamentally misframed when it's told as the Queen Mother concealing her disabled cousins. His position: the disability affecting all 5 women appears to have originated in Fenella's Trefusis family line. The Fane cousins had no Bowes-Lyon blood whatsoever. They were maternal cousins, connecting through Fenella's side entirely. The disability was Trefusis. The care decisions were Fenella's, and the family dynamic at the center of the institutionalization was therefore not the Bowes-Lyon/Strathmore network, but Fenella's own extended family, confronting a genetic pattern it had encountered repeatedly. That argument narrows the attributable responsibility significantly. It belongs in the record. It doesn't change the geometry of what happened to Nerissa and Katherine, who were Jock's daughters and Elizabeth's first cousins, regardless of where the disability originated. Several popular accounts have tried to connect the 1941 mass institutionalization to Edward VIII's abdication in December 1936, the suggestion being that a family newly elevated to the throne would have heightened sensitivity about any public association with hereditary disability. One source that covers this history specifically addresses the inference and dismisses it. Any connection between the abdication and institutionalizing these 5 cousins is only speculation. The 5-year gap between the abdication and the admissions makes the direct causal connection thin, and no documented correspondence or recorded conversation establishing that link has been identified. The timing may be coincidence. It may be context. The evidence doesn't resolve which. What Fenella arranged in June 1941 was the transfer of care from her household to Royal Earlswood for both her daughters simultaneously, alongside 3 additional family members with similar disabilities. The family paid £125 per year to the hospital for Nerissa and Katherine's care. That specific figure is the clearest single measure of what their continued existence was worth as a formal financial obligation to the Bowes-Lyon family. Not a figure that provided any income to the women themselves. Not a figure that funded anything beyond their basic institutional maintenance. A flat annual payment. And then whatever private reckoning Fenella made between the daily reality of their continued survival and the social calculation she had decided to perform. Fenella continued to visit. This is where the story of the 1941 admission becomes psychologically distinct from the standard narrative of aristocratic concealment. Fenella didn't send her daughters away and erase them from her own experience. She traveled to Redhill. She maintained direct personal contact with both Nerissa and Katherine throughout the 1940s, through the 1950s, into the 1960s. She knew their faces. She knew whether they responded to her presence. Whatever she encountered in those visits, whatever version of her daughters existed inside the hospital, whatever recognition or absence of recognition she found on those ward floors, she carried that knowledge back with her and continued to inhabit a social world in which her daughters officially didn't exist. None of Fenella's contemporaries appear to have pressed the question. The aristocratic world in which she moved didn't require her to reconcile the visiting and the concealment. Both could coexist, because the culture of the era had made concealment the expected and normal response to disability, such that no one was monitoring for hypocrisy. She was doing what families like hers did. The question of what her daughters actually experienced in those years wasn't a question her class was asking. Burke's Peerage was founded in 1826 as a genealogical reference for the British aristocracy and gentry. By the mid-20th century, it had acquired the status of an authoritative document, the official record of British aristocratic lineage against which questions of precedence, title, and family membership could be formally resolved. Genealogists used it, courts referenced it, historians relied on it. The entries carried an implicit weight of verification, precisely because they appeared in a serious, established publication, rather than a family newsletter or personal correspondence. The mechanism behind that apparent authority was more fragile than it looked. Families received forms and filled them in. They returned the completed forms. Burke's Peerage published what families submitted, without independent verification of the deaths, births, and marriages that appeared in entries. The publisher was entirely dependent on the accuracy of what the people most interested in controlling their own family narratives chose to report. The system was designed for cooperation, not adversarial use. It had no procedure for dealing with families who submitted false information as a deliberate act. Sometime before the 1963 edition, Fenella received the form. The exact date she completed and returned it isn't documented. What is documented is what she wrote. Nerissa, died 1940. a death date placed a full year before the actual institutionalization in 1941, a date that predated not only Nerissa's continued survival, but her very admission to Royal Earlswood, creating a fictional death that occurred before the real arrangement even began. Katherine passed away recently, which Burke's Peerage recorded as a 1961 death, in an edition published 2 years later, in a year when Katherine was 36 years old and had already spent 2 decades inside the hospital in Redhill. Both false death dates appeared in the same single publication event. The 1963 edition, 1 form, 1 submission, 2 false deaths. Fenella wrote these dates while actively maintaining her visiting relationship with both women. She wasn't confused about their status. She wasn't uncertain whether they were alive. The visits continued after the form was returned. The primary reference document of British aristocratic lineage now stated, in a work consulted by genealogists, historians, and aristocratic families across the country, that 2 living women their mother would visit again after filling in their deaths, were dead. Burke's Peerage printed it without question. The entry stood. When the story broke publicly in 1987, Burke's Peerage issued a statement. There had been no attempt to cover up the cousins' existence, and the false entries resulted from errors made by a family member when filling in the forms they were sent. The publisher acknowledged it had been deceived. No formal correction or retraction has subsequently been published. Burke's Peerage's characterization of these entries as errors reflects its institutional position rather than any serious analysis of intent. Fenella visited Nerissa and Katherine throughout the period before and after she submitted the form. An error is a wrong date written in haste, a death year misremembered, a clerical mistake made without access to contrary information. What Fenella submitted was specific, a year for Nerissa predating their institutionalization, and a recent death year for Katherine, written by a woman who had personal knowledge of both daughters' continued survival. The word errors was Burke's Peerage protecting its own credibility by the most generous available interpretation of what had been done to it. In 1966, Fenella Bowes-Lyon died. She had maintained her visits for 25 years, a quarter-century of traveling between 2 realities, the social world in which her daughters were dead, and the Redhill Hospital where they weren't. After her death, the available record of contact between the Bowes-Lyon family and Nerissa and Katherine becomes thin and contested. One source claims no records of family visits exist after the initial period. Another indicates Bowes-Lyon family members visited during the years of confinement. Whether the visits that Fenella sustained were continued after 1966 by anyone else in the family, and on what frequency, the available sources don't confirm with certainty. What is clear is that the one person who had maintained any sustained, direct, personal knowledge of the sisters' actual lives, their faces, their responses, whatever daily reality existed on those hospital wards, was gone. Both women had been officially dead in print for 3 years by the time Fenella died. Katherine was 40. Nerissa was 47. Both had been inside Royal Earlswood for 25 years, which meant that more than half of Nerissa's life, and more than half of what Katherine had already lived, had been spent inside the institution's 88 acres. They had arrived there before the NHS existed, before the end of the Second World War, before the welfare state had taken its modern shape. They had been there through the Festival of Britain in 1951, and the coronation in 1953, and the first televised Christmas address, and the moon landing, and the 3-day week, and the winter of discontent, and Thatcher's election, and everything that constitutes the texture of British life across 3.5 decades. None of it entered Royal Earlswood in any form they could act on. The institution processed events in the world the way all long-stay institutions of that era did, by insulating its residents from them. The ward routine was the same whether it was 1945 or 1970. The 88 acres remained the 88 acres. Britain changed in ways that would have been inconceivable in 1941. The deinstitutionalization movement gathered political force through the 1970s and 1980s. Disability rights organizations emerged and grew. Legislation shifted. Large Victorian-era institutions closed across the country as government policy moved toward community-based provision. Royal Earlswood continued operating. Nerissa and Katherine continued to live there. The official genealogical record of the British aristocracy continued to list them as dead. Outside the hospital, Nerissa Bowes-Lyon had no public existence. She left no footprint in any accessible record except the false one, the 1963 Burke's Peerage entry recording her as having died 23 years earlier. Her name appeared in no family announcement, no society column, no charitable donation acknowledgement, no record of any kind generated by the network into which she had been born. She existed only in the institutional archive in Surrey, in whatever internal documentation Royal Earlswood maintained for its residents, and in the visits, however many or few, that anyone in her family made to see her. Katherine existed in the same narrow strip of documented reality. On January 22, 1986, Nerissa Bowes-Lyon died at Royal Earlswood Hospital. She was 66 years old. She had spent 45 years inside its walls, more than 2/3 of her entire life, every year of her adulthood from the age of 22 until the day she died. The entirety of post-war Britain passed during her confinement. Governments changed, monarchs changed, the social landscape of the country transformed beyond recognition, and none of it reached her, except in whatever residual form the institution let in. She died inside the same facility where she had been placed in June 1941. Hospital staff attended the funeral. She was buried at Redstone Cemetery near the hospital, in a pauper's plot, not a family grave, not a headstone carved with her name and dates and family connections. A pauper's plot, the burial ground designated for those without the means or the family engagement to arrange anything more substantial. The marker identifying her burial site was a small plastic tag of the kind attached to institutional graves across Britain during that era. Durable enough to last a few years in the ground, cheap enough to produce in quantity, carrying the minimum information required to distinguish one burial from another. That plastic marker bore the name Nerissa Bowes-Lyon, the same Nerissa Bowes-Lyon that Burke's Peerage had recorded as dead in 1940, the same name that had been absent from every accessible family record, every public acknowledgement of the Bowes-Lyon family's composition for over 4 decades. Burke's Peerage said she had died 46 years before this marker was placed in the ground. The marker existed because she had died in 1986 in a Surrey hospital, attended only by the people whose professional responsibility it was to be there. 1 year after Nerissa's death, a journalist visited Redstone Cemetery and found the marker. The specific circumstances of how that visit came about, what the journalist was looking for, whether they were already investigating the Bowes-Lyon family or stumbled onto the name in the course of unrelated research, aren't documented in available sources. What is documented is the discovery itself and its logical consequence. A name in a pauper's cemetery that contradicted a death date in Burke's Peerage by 46 years. The Sun ran the story in 1987. Its headline, as contemporaneously reported by the Los Angeles Times, was direct: Queen's cousin locked in madhouse. The LA Times published their own coverage on April 6, 1987, under the headline, "Burke's Peerage Given Faulty Facts, Queen's Dead Cousin Alive in Hospital." The following day, the UPI Wire reported from London that 3 additional relatives of the British royal family, Idonia, Etheldreda, and Rosemary Fane, had been admitted to the same institution on the same day as Nerissa and Katherine in 1941. For decades, the story had been contained entirely within the institution and whatever remained of family memory. Now, it was a wire service dispatch. Katherine Bowes-Lyon was 60 years old when the Sun story ran. She had been inside Royal Earlswood for 46 years. She had outlived her mother by 21 years. She had outlived her sister by 1 year. The official record had listed her as dead since 1963, but she was alive on the ward when the story broke, and the world now knew it. Royal Earlswood began receiving bouquets of flowers, hundreds of them, from members of the public. People who had never heard the names Nerissa or Katherine Bowes-Lyon before the newspaper ran the story, sending cut flowers to a woman classified as officially deceased. A stranger whose existence had been a secret for their entire lifetimes. The hospital wards weren't typically places where large quantities of flowers arrived from anonymous well-wishers. The scale of the response reflects how viscerally the story landed with an audience that had grown up under the Queen Mother's carefully curated image of maternal warmth and familial devotion. No official statement from the royal family or the Bowes-Lyon family has been documented in response to the 1987 coverage. No legal challenge to the newspaper's reporting followed. The story published, the flowers arrived, Katherine received them, or someone received them on her behalf, given she couldn't communicate in ways the outside world would have recognized, and the family, publicly, offered nothing. One account, reported in the Daily Mail in 1987 and referenced again in 2023, claimed the Queen Mother had only been told the sisters were still alive in 1982, 41 years after their institutionalization. If accurate, that would mean the cover-up had been maintained by other family members without her knowledge for 4 decades. That she learned of her brother's daughter's continued survival when Nerissa was 63 and Katherine was 55, and that whatever she did upon learning this happened in the 5 years before Nerissa's death in 1986, years during which Nerissa died in a pauper's plot, attended only by staff. The nature of whatever response the Queen Mother reportedly made upon learning in 1982 is unknown. The source excerpt cuts off before completing the description, and no independent corroboration of the 1982 date has been found. It's a single tabloid account, and it remains contested. What the 1987 exposure definitively established was that Katherine was alive. The Burke's Peerage entry was a lie. The family had known it was a lie. The publication had been deceived. The official genealogical record of British aristocratic families had declared a living woman dead for 24 years and had never issued a correction. Katherine lived for another 27 years after the story broke. 27 years, during which the false death date in Burke's Peerage sat in documented public contradiction to her continued existence. She remained in institutional care, Royal Earlswood, until its closure on 31st March 1997, and then whatever provision was arranged through the NHS successor services as the old hospital's residents were redistributed into other settings. The hospital's closure came amid allegations of irregular care and abuse, a closure that placed its remaining residents, including Katherine, into the deinstitutionalization process that most British long-stay hospital residents had already gone through a decade earlier. She was 70 when Royal Earlswood finally closed. She had been there since she was 15. the closure that the wider disability rights movement had been pushing for since the 1970s arrived for her decades after it had arrived for most other long-stay residents. The building she had lived in for 56 years stopped being a hospital. Its 88 acres were converted to residential development. Katherine went wherever the NHS placed her. On 23 February 2014, Katherine Juliet Bowes-Lyon died at the age of 87. A private family funeral was held. No pauper's plot this time. Nerissa's burial in 1986 had become a documented public embarrassment. The specific detail that put a physical, locatable object into the hands of a journalist, and the family had apparently absorbed the lesson. Katherine's funeral was private, arranged by family, managed without the institutional default that had given Nerissa only a plastic marker in a pauper's cemetery. Her total confinement? 73 years. From age 15 to age 87. The whole of her adult life, and then some. She was younger than the century when she was admitted, and outlived it by 14 years. Era context isn't a defense against this specific documented act, but it's a necessary part of the frame, and it requires direct engagement rather than dismissal. Institutionalizing disabled relatives was standard practice across British aristocratic and upper-class families through the mid-20th century. The Bowes-Lyons weren't doing something that shocked their peers. Large, long-stay institutions across Britain housed enormous numbers of long-term residents from families of every social class. The social consensus, reinforced by medical authority and cultural shame, was that severely disabled people were better managed in professional institutions. As one social history of the period records, well into the 20th century, secrecy forged the bonds of family responses to disabled members. The concealment was nearly universal. No upper-class British family of that era was building its public genealogical record around its institutionalized disabled members. The Bowes-Lyons were doing what their class did. That context is documented and belongs in the record. Here is what distinguishes this specific case from that general background. No comparable documented example of a British aristocratic family falsifying Burke's peerage entries to declare living institutionalized relatives dead has been identified in the historical record covering this period. Other families institutionalized and concealed. The silence was endemic. But the gap between "we don't mention them publicly" and "we have submitted specific false death dates to an official genealogical publication" isn't a matter of degree. The difference is the deliberate creation of a documentary lie in a reference work consulted by anyone who wanted to know the official composition of British aristocratic families. A private silence leaves no evidence. A false Burke's peerage entry is a public assertion, preserved in editions that sat in libraries, that 2 living women were dead. It's the active manufacture of a false record, rather than the passive omission of an inconvenient truth. That documented distinction, the specific act of writing false death dates into an official publication, is what makes the Bowes-Lyon case different from the general cruelty of its era. The question of Elizabeth Bowes-Lyon's personal role requires precision rather than simplification, because the popular framing and the evidential record aren't the same thing. The documented agent of the falsification was Fenella Bowes-Lyon, the sister's own mother. Burke's peerage confirmed this when the story broke. The institutionalization decision was made by the family collectively, with Fenella as the operative decision-maker, given she was the surviving parent. Gareth Russell's structural argument that the disability traced through Fenella's Trefusis line, that the Fane cousins had no Bowes-Lyon blood at all, that this is properly understood as a Trefusis family situation rather than a royal cover-up, places both the biological origin and the decision-making agency firmly within Fenella's sphere of responsibility. No letter, instruction, recorded conversation, or documented communication places Elizabeth Bowes-Lyon as directing or endorsing either the institutionalization or the Burke's peerage falsification. The research record is explicit about this absence. No evidence exists of a royal decree to erase them, no secret order from the Queen Mother. Burke's peerage itself attributed the false entries not to the Queen Mother, but to a family member filling in forms. What is equally documented, Elizabeth Bowes-Lyon was the most prominent member of the Bowes-Lyon family for 50 years. Nerissa and Katherine were her brother Jock's daughters, her nieces by any plain reading of the relationship, her first cousins by the framing that most sources use. She had the means, the access, and the social influence to know about their situation, to ensure that when one of them died, the burial wasn't a pauper's plot marked by a cheap plastic tag. She had resources to spare. She ran up debts documented in multiple accounts. She maintained an extraordinary public lifestyle while a £125 annual payment to Royal Earlswood constituted the sum total of the family's formal provision for her brother's 2 disabled daughters. None of what a more engaged family member might have done appears in the record. The contested Daily Mail account, that she wasn't told the sisters were alive until 1982, would, if accurate, substantially shift the moral arithmetic. It would make her a recipient of the concealment rather than a participant in it. But it comes from a single tabloid source with an incomplete excerpt, and it hasn't been independently corroborated. The question of what she knew and when she knew it isn't resolved by the available evidence. What the evidence does establish is this. An official document recorded 2 living women as dead for 24 years. Both women spent their entire adult lives inside a Surrey institution. One died in a pauper's grave. The other lived long enough to receive flowers from strangers who only heard her name because a journalist found her sister's burial marker. The family offered no public statement when the story broke. Burke's peerage never published a correction. The most prominent member of the family that benefited from their erasure built her public identity on values of warmth, accessibility, and familial devotion that the documented treatment of Nerissa and Katherine contradicted entirely. Whether Elizabeth was architect, passive beneficiary, or genuinely uninformed party, each of those possibilities produces a different moral verdict, and the evidence available doesn't resolve which one is true. What it does resolve is that the gap between the public image and the documented reality isn't ambiguous, and that closing that gap required outside journalists, a plastic grave marker, and a Sun headline rather than any act of acknowledgement or accountability from within the family itself. Marion Crawford had worked as governess to Princesses Elizabeth and Margaret for 17 years before she left royal service in 1948. In 1950, she published The Little Princesses, a memoir of her time in the household that, read today, appears by any reasonable standard as a fond and restrained portrait. Gentle anecdotes, affectionate descriptions, nothing that registers as damaging disclosure in any modern reading. The Queen Mother had previously given Crawford some degree of permission related to memoirs. One biographer describes the book that destroyed Crawford's life as something that today seems innocuous. Crawford was cut off completely. The entire royal household withdrew contact. She spent the rest of her life estranged from the family she had served for nearly 2 decades. Her offense wasn't the content of the disclosure. It was the act of disclosing without full authorization. She had written about private life. That private life was the property of the family, not of the person who had witnessed it. The punishment was designed to be visible, a public example made of a former employee who had spoken as a demonstration to anyone else who might be considering a similar act. It worked. No comparable memoir emerged from royal household staff during the Queen Mother's lifetime. The Crawfey affair belongs in this story not as proof that the Queen Mother personally designed the Burke's peerage falsification. The evidence doesn't support that claim, and this script won't make it. But as a documented case from the same household, the same family network, during the same decades in which unauthorized information about the family's private life was suppressed through the most efficient available mechanism. With Crawford, the mechanism was social. The false Burke's peerage entries deployed paper rather than ostracism, but the underlying dynamic, information about this family exists in controlled form or not at all, produced consistent results across different contexts and methods. Fenella made the specific choice to write false death dates on a genealogical form. Whatever conversations occurred within the Bowes-Lyon family network before that decision, whatever social and institutional pressure shaped the environment in which that decision felt both possible and necessary, those conversations aren't in the documentary record. What is in the record is the decision, its consequences, and the family's collective silence when it became public. Princess Margaret occupied a different position within the same family architecture. She and the Queen Mother both drew on royal incomes that were exempt from taxation under arrangements documented across multiple sources, a financial structure that mirrored the broader logic of aristocratic privilege, in which public expectation and private reality operated on separate tracks. Margaret's conduct, her treatment of household staff, the deference she expected as a natural condition of her existence, the consequences that followed for anyone who failed to perform adequately in her presence, is recognizably an expression of the same underlying values her upbringing had installed, rendered without the discipline of the public warmth that had made the Queen Mother genuinely popular over decades. The Queen Mother's particular skill was sustaining the performance. Margaret inherited the values without perfecting the performance. That is why contemporary reactions to the two women differ so sharply. The Queen Mother's conduct was buffered by an image that took decades to construct and required active, sustained maintenance, while Margaret's was more immediately legible as exactly what it was. The performance was the product. Remove it, and the underlying structure becomes visible. Queen Elizabeth II became queen in 1952. Her mother remained a structural presence at the center of royal life for the next 50 years. A former Queen Consort who had made herself functionally indispensable to an institution whose domestic and ceremonial rhythms she had shaped for 2 decades. Multiple biographers and sources close to the palace noted a discernible shift in Elizabeth II's conduct and household decision-making in the period following the Queen Mother's death on March 30, 2002. A woman who had exercised global institutional authority for half a century appeared, to those paying close attention, to move into a more direct personal register after her mother was gone. That dynamic, the most powerful woman in the country, constrained within her own household by the force of an elderly mother's presence and expectation, represents the soft version of the same instinct that governed the treatment of Nerissa and Katherine. No papers signed, no documented instructions issued, no explicit orders recorded. The constraint was structural, relational, maintained by social gravity rather than official mechanism. The Bowes-Lyon family's control of its own inconvenient members ran across a spectrum. At one end, the soft management of a daughter's conduct through the uncodified weight of maternal expectation. At the other, the administrative fact of 2 women declared dead in print while alive in an institution. Different mechanisms, recognizably the same underlying architecture. Katherine Bowes-Lyon died on 23 February 2014 at 87 years old. Between Nerissa's institutionalization in June 1941 and Katherine's death 73 years later, the two sisters accumulated a combined total of 118 years inside Royal Earlswood Hospital and its successor care arrangements. 118 years of institutional life lived against the backdrop of a family official record that said they had both been dead since the early 1960s. No formal correction has ever been published by Burke's Peerage to the 1963 entries listing Nerissa as dead in 1940 and Katherine as dead in 1961. The publisher's explanation, that a family member made errors filling in their forms, stands as the official account on record, unrebutted in any formal editorial context, unsupplemented by the correction the facts demanded. The British class system produced the conditions that made this possible. It produced institutions for managing people who didn't fit. It produced genealogical publications that trusted families with their own records. It produced a culture in which the concealment of disabled relatives was so normalized that submitting false death dates to an official publication was a calculable act rather than an obviously outrageous one. The specific falsification, the act of writing those dates, returning that form, publishing those entries, required a social infrastructure willing to look away in order to function. That infrastructure existed, and the Bowes-Lyon family operated within it. The specific cruelty that distinguishes this from the general historical record of aristocratic concealment is the paper. Not the institutionalization. That was endemic. The paper. The deliberate conversion of a private arrangement into a public lie, preserved in a reference work consulted for decades, maintained without correction for 24 years after publication. The two women in Royal Earlswood weren't merely hidden. They were officially killed. They existed in the documentary record of the British aristocracy only as deaths. Specific years, recorded in a publication that claimed to be the authoritative account of who those families contained. Nerissa's plastic grave marker, found by a journalist in 1987, is the single object that made the lie undeniable. It existed because Royal Earlswood marked its dead regardless of what Burke's Peerage said. The institution knew she was alive. The institution knew when she died. The institution buried her and placed a marker. The official record of her family said she had been dead for 46 years. The cemetery marker said she had been alive until January 1986. Two incompatible documents, one real person. Nerissa Jane Irene Bowes-Lyon, born February 18, 1919. Died January 22, 1986. Katherine Juliet Bowes-Lyon, born July 4, 1926, died February 23, 2014. Both recorded as dead in 1963 by the authoritative genealogical record of British aristocratic families. Both alive when that edition went to print. Both real. If you want more stories like this one, subscribe.